Let's go over another test taking strategy, and I'll walk you through it using an example of an NCLEX style question. So here's your question. A nurse is caring for a post-op client who has not voided for 6 hours. The bladder is distended and the client reports discomfort. What is the best initial action? A, notify the provider for an order to insert a Foley. B, assist the client to the bathroom and run water from the faucet. C, perform a straight catheterization per PRN order. Or D, encourage the client to increase oral fluid intake. So this question is asking, what is the best initial action for urinary retention? Your keyword in this question is initial. So with the options that you're presented with, you have to think about what you would do first. So taking a question like this, you want to go least invasive to most invasive. So let's start with option D, encouraging oral fluids. That's not invasive, but it's also not effective when the bladder is already distended. How is that helping the situation? Eliminate that answer. Options C and A are kind of similar. Straight catheterization and Foley catheterization are both invasive procedures, require a physician's order, and you would only use these if your least invasive option fails. So the most correct option would be B, help the patient to the bathroom, run some water. It's non-invasive and it promotes natural voiding. This is a better choice. This trips up nursing students quite a bit. Always line up your options from least invasive to most invasive. Then pick the option that addresses the problem safely with the least risk. So in this scenario, helping the patient to attempt voiding naturally comes before anything with a catheter and inserting things into the body, because then you have infection risk and things like that.